Welcome to First Aid. I'm Kelly Kinkaid, and today my guest is Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Disease and the Chief Medical Advisor to the President. Hello, Dr. Fauci.
Hi, Kelly. Good to be with you.
Yes, thank you. First of all, thank you for all of your contributions to medicine and to the country. Let's get started. So today we had a big announcement. Every day we're hearing information about COVID-19 on our phones, computers, TV. And we're here today because of the good news that the Biden administration announced about Americans getting an updated COVID booster shot. Let me start with myself. I am vaccinated with the Johnson & Johnson and I got boosted. So someone like myself who may be skeptical because I have been blessed that I have not had COVID-19 the past couple of years, why is it important for someone like myself to go get this second booster shot?
Well, Kelly, when you look at the statistics, which don't lie, about people who are vaccinated, unvaccinated, or vaccinated and boosted twice, the more you get the protection, the less a chance you have of getting hospitalized and getting severely ill and perhaps even dying.
Right.
So the fact is, if you want to give yourself the optimal protection, what we have now available this week is an updated vaccine that is matched exactly to the circulating virus in the community, the BA.5 variant.
Mm-hmm.
So the vaccine that's being available now is what's called a bivalent vaccine. It has the component of the original vaccine and a component of the new variant, the BA.5 that's circulating. So you get a much more specific protection.
Right. Okay. And now that you're saying this second booster shot is available this week, why this fall should we be getting it?
Well, there are a couple of things. First of all, there is still a considerable amount of activity of the dynamics of the virus. We're still losing from 350 to 450 people a day, which is an unacceptably high level.
Right.
That is very disproportionately high among the unvaccinated and under-vaccinated. Number two, as you get into the fall season and people, because of the cooler weather in most parts of the country, people tend to congregate indoors where respiratory infections tend to thrive.
Mm-hmm.
We know from many, many, many decades of history that in the winter, when you get people inside, influenza, parainfluenza, all of the respiratory infections tend to go up.
Right.
So we're not going to be surprised if you get an uptick in infections as the weather gets cooler. And that's the reason why now is the time, if you have not been boosted, if you've gotten a boost longer than 2 months ago, then you should get this updated vaccine.
Okay. I've already seen some health professionals and advocates say, wait until October. What say you about that?
I say that you should get it within a period of time that is recommended by the FDA and the CDC. So the recommendation is, if you've been vaccinated more than 2 months ago, you should get the upgraded vaccine now. If you were infected more than 3 months ago, you should get the updated vaccine. So let me give you my example. I'm vaccinated, I'm doubly boosted, but I did get infected in the middle and end of June.
Okay.
So 3 months from then is going to be the end of September, the beginning of October. So I'm going to get vaccinated with the new updated vaccine, probably the last week in September, the first week in October.
Okay. Let's talk about, I think this is great news, what the administration is providing, because it's free. Let's talk about what the rollout is with the Biden administration for everyone who are questioning how to get it.
Well, that's one of the things in the announcement that you mentioned, Kelly, that came out today,
Yeah.
is that they're mobilizing millions and millions of doses in areas to make it very easy for people to get vaccinated, so that there will be vaccine for 90% of the people in the country. Will have a supply of vaccine within 5 miles of where they live. So it should be very easy for someone to get this updated vaccine that's matched to the circulating strain.
Yeah. Do you think that this, as having a booster shot, will eventually just be like getting a flu shot every year?
Yes,
Yeah.
absolutely. In fact, at the press conference a couple of days ago, I made that point
Mhm.
explicitly, that we are moving towards a cadence or a pattern of most of the people.
Yeah.
Not everyone, but most of the people will get into a rhythm of getting an updated vaccine once a year on an annual basis, very similar to what we do with influenza, because the durability of the protection of a vaccine wanes over time, even for very healthy people. Now, if you are an immunocompromised person, you may need to get an additional shot more than once a year. But for most of the population, 1 year is about the amount of time you want to give your system to be protected before you have to re-up it and re-stimulate the immunity.
Right. Now that, Dr. Fauci, now that masks are becoming optional, do you think that we will be able to live in a maskless world?
Well, if we get the level of infection broadly throughout the country, and since we have such a large country, it's going to be uneven. There are
Yeah.
going to be some places that have a higher degree of infection than others. But the goal, Kelly, is to get the level of infection so low throughout the country that it would be very unusual for us to have to wear a mask.
Okay.
Maybe during the winter seasons when it's crowded in indoor settings, yes. But the goal is to get to the point where we won't have to be wearing a mask.
Okay. And my final question to you, Dr. Fauci, first, congratulations on your upcoming retirement.
Thank you.
Put in a lot of work, a lot of time and service to all of us. What is it that you want your legacy to be leaving this position?
Well, I have been at the NIH for 54 years. I've been the director of the institute that does all the work on infectious diseases for 38 years. And I've done some things with the help of a lot of people that I believe has been a major factor of improvement in the health of the nation and indirectly in the world. We created the AIDS program. We developed the drugs for AIDS that saved millions of lives. We've responded to emerging infections like Ebola, Zika, pandemic flu. And I had the privilege of working with President George W. Bush to create the PEPFAR program, the President's Emergency Plan for AIDS Relief, which has saved about 20 million lives throughout the world. So I tried my best, and I hope I did a good job, and that's what I'd like to be remembered for.
Yes. Well, this is truly an honor, Dr. Fauci, to speak with you and have your time and your wisdom and knowledge. I am definitely a big advocate of, making the world a better place, just like yourself. And, I hope your holidays are great and you stop working. Stop working. enjoy this time for retirement, but I hope to see you from time to time. I know that you've been a part of the country with giving us so much of great information in the medicine world. I know that this is not going to be the last we see of you.
Righto. Thank you for having me, Kelly.
Thank you. This is First Date with Kelly Kinkaid and my guest, Dr. Anthony Fauci. Until next time.
This program contains true stories of rescues.
It's First Aid with Kelly Kinkaid.